Good. So let me kind of rotate you. Nice. Good. Relax. This side. Good. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and I'm here with Ashley today. Ashley is our new chiropractic intern, so she'll be Dr. Ashley in a couple months. She graduates in December, so we're happy to have her on board and hope to make it a great experience for her. But she's having a little bit of some soreness going on right now in the mid and upper back and in that shoulder blade area. Do you want to tell us a little bit about your history on that?
I think like a lot of shoulder issues recently, and maybe it's kind of presenting itself in mid-back and rib tightness and restrictions, I would say.
Okay. So we're going to check her out. We're going to watch her move a little bit, and then we'll palpate the joints and get her all tuned up so she's feeling better. Sound good?
Yeah.
All right. We're going to go ahead and have you stand over here, Ashley, and we're just going to start with looking at your movement from head to toe. So I'm going to have you keep your feet together, and we'll start with your neck, and I want you to just go ahead and turn your neck right and left as far as you can. Okay? And to the left, and right one more time, and left one more time. So when I'm looking at Ashley's rotation, her chin should be clearing. I'm going to touch your collarbone, okay? Her chin should be clearing about the midpoint of the clavicle. So when she goes left, she's hitting a wall a little bit prior to that, and I'm noticing a little bit more a little bit on the left side too, but more on the right. Do you feel that difference? Mm-hmm. Okay, so now I'm gonna have you face this wall, Ashley, and we're gonna check feet together, and we're gonna look at neck extension and flexion. So go up at the ceiling as high as you can. Not too bad there. She's got a pretty nice angle here, about 80-90 degrees. Now we're gonna try to touch your chin to your sternum. And you can see under there, coming up a little bit short. We want to try to get with. She has to open her mouth in order to get that chin there, so just showing us that she's lacking a little bit of flexion in the cervical spine. So a little bit of rotation restriction and flexion restriction going on right now as far as active range of motion. So now I'm going to have you go ahead and try to touch your toes. We'll check out full spine flexion.
Oh,
and where do you feel that?
Hamstrings and back.
Lower back?
Yeah.
Yeah, kind of lower to coming up in
like right here.
Okay, more of a sacral area too.
Mm-hmm.
Okay. And then go ahead and reach above your head, Ashley, and arch backwards as far as you can. Any discomfort there?
Not bad.
Okay, come back upright and bring those feet together all the way. And then I'm going to have you hold your arms out in front of you and go ahead and do a squat. Come back up. So we're noticing that she's got limited flexion. She's having some lower back and sacral discomfort when she's going and doing the toe touch. And then go ahead and do the squat one more time. And she's just not clearing below parallel with that. What holds you back when you do that, Ashley?
I would say ankles, hips.
Ankles and hips?
Probably even like...
Little lumbar?
Yeah.
Okay.
Yeah.
So we're seeing multiple levels of restriction in the joints there. We're going to go ahead and turn around now, and I want you to go ahead and keep those feet together, Ashley, and we're going to rotate left and right with your full spine. Okay, and then back to the left. A little harder left. Mm-hmm. Yeah. So she's not clearing where we'd like to see that shoulder coming out right around here. We're coming up short both sides, but she's a little more limited on the left than the right. Now we're going to check some shoulder mobility. So I'm going to have you one at a time reach above your head and touch the top of the opposite shoulder. Good. And then do the opposite side. Good. Now reach underneath and touch the bottom of the opposite shoulder. So she should have a very clear angle, and that should be coming right up through here. You can see like this is very limited. She's got a little winging going on in this shoulder blade as well. And this is like the problem side on you too, right? Mm-hmm. Go ahead and do the other one. Little bit better, but she's having to kind of kink that wrist up to try to make up the difference. So she's still coming up short on this side. Actually, a little bit more winging on the left than the right. Go ahead and relax. And let's go ahead and have a seat on the end of the table, and we're just going to palpate next. So I'm going to start under pelvis, and we're just going to challenge the joints. When I'm going in here and palpating, I'm trying to take the joint to end range, and then I'm testing how much end range it has at the end of that motion. So a healthy joint that's moving well should have some nice spring to it. Should feel kind of spongy when I push into that. Joint that's restricted giving someone some issues. It's going to be a lot more firm at end range, and it's usually a little uncomfortable for the patient when I'm pushing into that. So I'm going to start in your SI joints, and I'll work my way up, and you just let me know if any of this is uncomfortable. Side, rotate. Any of that uncomfortable?
Just a little tender.
And I'll be just at the sacrum level, and we're going to go back. And then I'm going to go down just a little bit. Any tenderness there?
Just that one.
Right in there?
Yeah, like sacral base.
Okay. Lumbars are definitely not happy. Is that pretty painful when I'm pushing, or tender?
On the right, yeah.
Yeah, like over here.
Mm-hmm.
Try a little rotation. There. So I'm noticing a little bit more left rotation and extension restrictions, but more present on the right side of her lower back. And we're gonna just kind of work up the spine. That TL isn't happy either, so our thoracolumbar junction is not moving. And then as I get up into mid-thoracic, she's really locked up through here.
Yeah.
Okay, go ahead and bring your hands behind your head. We're gonna feel the rest of the thoracic spine by having you lean forward, and then just gonna, so she's really limited in extension through here, which is very common, especially for the student population as they're flexed forward all day, studying on the computer, all the above. We're gonna work a little bit into CT here. Not too bad there. That's tender, huh?
Mm-hmm.
Yeah, so she's got a little bit more restriction of the CT junction on the right rather than the left, and then we'll work our way up into the rest of the cervical spine. C6 region, C5, C6 isn't quite as mobile as it needs to be, and then working our way up. Feel that?
Yeah, tender.
So kind of in the more of the upper cervical spine, she's got some restriction going on there too. Check the occipital level. A little over here. Not terrible though. Is that okay?
Mm-hmm.
And then I'm going to do one more evaluation on those shoulder blades since that's kind of the biggest problem area. Go ahead and go on your hands and knees, Ashley. And we're just going to look. Go ahead and go once you lean forward a little bit. So get on right on your hands, so your wrists are right under your shoulders, and then I want your knees right under your hips. So slide your weight forward a little bit. Yep. So we're gonna basically have Ashley kind of glide forward with her whole upper body and see what her shoulder blades are doing. So you can see that's kind of starting to wing and depress a little bit, and I'll come back to neutral. And now we're gonna go backwards with your hips, Ashley, so kind of keep leaning back. And you can see how the medial border of those shoulder blades is lifting up a bit. Come on forward, and now we're just gonna shift to the left. And that right guy is lifting up here. You can see that border, and then we'll go to the right. Not as prominent on that side. So everything's kind of pointing to that right scapula more than the left. Go ahead and come back up, Ashley. So with Ashley, she's got some limitations all the way up and down the spine. Related to her shoulder blade and that rhomboid area, that medial scapula, we see a lot of issues with in our patient population. It's kind of a combo. We got to get the thoracic spine moving, and we also have to work some stability with her shoulder blades. And this is a common thing. We get a lot of patients in here that are chest breathers. So when they're breathing up here all the time, these aren't really supposed to be accessory breathing muscles, so they get engaged all the time, especially this upper trap, levator scap region. And then what we notice is that there's a inactivation in more of that mid trap, lower trap, rhomboid, serratus anterior. Those are supposed to be helping depress that shoulder blade up against the rib cage more. And when we're forward all the time, especially when we're doing studying and things like that, the pecs get a little overactive, the suboccipitals get a little overactive, that pulls us all forward, and that just accentuates everything that we're seeing with her. So she's got some postural abnormalities that would definitely correct on the rehab side, but today I'm gonna go in and I'm just gonna do a little bit of some muscle work over that shoulder blade first before we adjust. Kind of work up into the neck, and then we'll get her adjusted and retest her range of motion, and should be good to go. Sound good?
Sounds good.
So I'm gonna just start kind of in this medial scap area, and actually I'm just gonna be putting a little pressure on that, and you're gonna reach across your chest. Okay? So go ahead, reach across, keep reaching, trying to touch that wall. Feel that?
Oh yeah.
And then come back. Tell me if it's too much. Should be kind of a good hurt.
Yep.
Basically what I'm just trying to do is shorten and lengthen the muscle, and then I'm applying a specific pressure at certain points of the muscles and on specific muscles that are going to help create tension as she's reaching across and lengthening that muscle. This kind of helps release it and makes the adjustment go a little bit easier too. We get a little less muscle resistance. Good. Okay, and then I'm going to have you just let this whole arm relax on me here, and I'm going to even take it a little bit further, Ashley. Good. What are you feeling with this, Ashley?
A good stretch.
The good hurt, right?
Oh yeah.
I'm going to work up a little bit higher here on alleviate or upper trap. And so now I want your angle to go more down to your left hip, okay? And then bring your chin in. Go ahead and reach down and left. And then hold that reach, and then really try to tuck that chin down and left. There you go. Good. So if all these muscles, like we noticed on Ashley when she was trying to tuck her chin down to her sternum, it was a little difficult for her to do that without opening her mouth. But if we're getting a ton of tension on the posterior side, that's going to resist her from going into more of that cervical flexion or even into the multi-segmental flexion that we observed with her. Again. Yeah, one more. Nice.
That's a good one.
Yeah, hold that. Sometimes we'll hold it a little longer at the end, and you'll kind of feel that muscle start to melt and relax. Good. We'll work up into the rest of the cervical spine. Very good. Right now, Ashley, I'm going to work the erector muscles, so we're going to have you kind of hug yourself, and I'm going to be more vertical on the spine to get that all worked out. So I'm going to be over here, and we're going to tension going down and left. How's that?
Nice.
Yeah. Yep, breathe. Do it again. Kind of let your air all the way out. And then when I tell you, take a breath in. Big breath in. You can get the ribs involved a little bit more here and get rib expansion at the end of the movement, which can help that release a little bit more. Breathe out. And then take a big breath in after I get to the end. Good. What are you feeling with that?
Just like a good stretch, and then like engagement of my breath with it.
Good. Relax. Okay, so now just go ahead and, before we adjust or do anything, I want you to go ahead and just turn left and right. See if that helped at all. And then look up and down. Down. How's that flexion motion feel?
Less of a pull and like I feel like a more smooth motion.
More smooth? Okay. Alright. Let's go ahead and get you on your side, facing me. And then we'll bring you around. Just relax. Good. So we'll do the other side. Nice. Good?
Uh-huh.
Alright, same thing actually. Just let me kind of rotate you. Nice. So we kind of saw this area and in the TL. So I'm gonna get this upper thoracic first. Ashley, just go ahead and take a breath and let it out. And then again. Good. And then now lift your head up. Hold your breath. Good. Relax. Okay. She had a little bit going on up here, so I'm gonna have you slide down a little bit, and then bring your arms to your sides. Okay. I'm just gonna use a little bit of a drop in that CT region. Alright. Go ahead and turn your head to the left. Right through here. One more. Good. Got that. All right. Ashley, go on your back for me, please. Right here.
Mm-hmm.
And relax. This side. Relax. Nice. Real good.
Yeah.
See how we're moving. Oh yeah.
Mm-hmm.
What are you feeling there now?
No more tender spots.
Feel that springiness?
Yeah.
We'll work up into the thoracics. I still want to get a little bit more here, so I'm going to do more of an A to P style adjustment on that.
Mm-hmm.
So go ahead and lay on your back. She had a little bit left in that lower thoracic spine. And out. Good. Back up. And slide down there. And we'll check that. There we go.
Mm-hmm.
I feel like you got it.
Oh, yeah.
Hands behind your head. And we'll go elbows together. I'll lean you forward. Bring it better in there.
Mm-hmm.
She'll probably tinker through some more active mobility patterns after we're done with this. But overall, joint plays better than it was before we adjusted. A little bit left on that left side, but better overall. Go ahead and stand over here again, Ashley, and we'll recheck those active patterns. So go ahead and face us, and then we'll just do feet together, and then turn your chin left and right. So she's clearing further on that collarbone than she was before. Good. Then side angle, we're gonna look up and down. So that was never really a problem going up, and then down. She said that was a little smoother.
Mm-hmm.
Okay, touch your toes. Improved from before, but we got some work to do. Again, we'll do more on like the rehab front with her there. Hands above your head, arch backwards. Good, and swap for me. That'll be more of a rehab front thing too, where we're working through some of those motor patterns, working her and with some more active mobility. But yeah, overall, how did that feel?
Very good.
Good.
Yeah, I feel ready to start the day now.
Good. Well, thanks for watching. If you want to see more, make sure you like and subscribe to our YouTube page.